radiology is improving, the lung compliance is better, his arterial oxyhemoglobin is improving, you know the patient is ready for a weaning trial. With cardiac failure, you know that, you can see good aortic pulsatility, you know the patient is ready for a weaning. So once he's had a CVP of less than 15, MAP of greater than 65, a pulse pressure of greater than 30, echo showing an EF better than 25%, no stasis. That is when you want to try to start decreasing the pump flow incrementally by 0.5 to 1 liters per minute. How we had increased it gradually, same we start reducing the pump flow. So VV-ECMO trials are performed by eliminating all countersweet gas through oxygenator, because you have to remember that VV-ECMO was done to basically help you out with your respiratory failures. So once we stop the gas flows, we want to know the blood without the gas flow is still maintaining the oxygenation. Now, VV-ECMO is because of cardiac is used more in cardiac failures or cardiomyopathies. So we clamp the drainage and infusion lines, and we try to see whether the native heart is being able to fulfill the body's demand. So you'll come to know with your lactates, with your tissue perfusion measures, whether the patient is doing. VV-ECMOs are generally shorter than the VV-ECMOs because of high risk of thrombus formation. Now, after knowing all this, we did what were the components of the ECMO. We saw what we had to monitor. And now we come to the complications. So we have bleeding. Bleeding occurs in 30 to 40% of patients. It is usually due to a heparin infusion continuous and platelet dysfunction. So you want to maintain a platelet count of greater than 80,000 to 1 lakh. You want to target the ACD. We want to maintain targets of ACT very judiciously. If there is a major bleeding, only then surgical exploration is done. If bleeding occurs, we decrease the heparin infusion and maintain ACT at 160. Remember, maintaining ACT at 160, we are increasing the chance of thrombus formation. Plasminogen inhibitors may be given, but again, thrombosis, so you have to see what is more dangerous for the patient. Is the bleed going to be more dangerous, or is the thrombus formation going to be more dangerous? Now, thromboembolism, this is the oxygenator, where you can actually visually see these clot formations or thrombus formations. Now, what happens if this thing is pumped back into the artery of the patient? These thrombus will cause embolism either in the limbs, or you will have retrograde even sometimes in the brain. So you have thromboembolism. Then you have cannula related things where you can have damage to the cannulas. You can have arterial dissection if the cannula is put in the artery. You can have bleeding because of dislodgement of the cannula. And in VA-ECMO, you can also have, because if you can see in the VA-ECMO, the blood supply is going to the artery in one direction. So the artery to the leg is not supplied by that blood. So this place tends to become black in color. So we put a small outlet of the arterial in a retrograde fashion and put it distal to the ECMO cannula. You have something called as heparin-induced thrombocytopenia. You have recirculation, where you can see the return cannula. If you can see the outflow, there are two arrows going. One is going to the circulation, one is going back into the access cannula. So whatever you're giving blood, half of it is going back into the access cannula. This is known as recirculation. So half of your oxygenated blood is going waste. We do not want that. So what you can do is increase the distance between these two cannula, or you can position it in such a way that this blood is directly flows to the heart and out of it. Thrombosis, like I told you, is a very common combination. Now, this is a very interesting thing, is the Harlequin syndrome or North-South syndrome, where the patient has a blue head, or upper part of the body is blue, and the red part is in the lower part. You can actually see that it's a biblical character, Harlequin. So what happens is the saturation of the upper part of the body is lower than that of the lower half. This is what it means, blue blood and red blood nature.